Hello, Wendell Foster. It's good to see everyone again. My name is Travis Johnson, and I am the benefits advisor here at EM Forward. And so I'm here with you today to discuss your enrollment guide and your benefit guide for 2022. It is pretty hard to believe that 2021 is almost in the rearview mirror, but here we are. So before we get started, I want to take a second and say thank you to your leadership team and your HR team for allowing us here at EM4 to partner with you all once again for your benefits for the 2022 year. And also want to take a second to thank you all, the employees, for working through such trying times and doing it so gracefully and impacting so many people's lives in such a positive manner. So thank you all so much for everything you do and how you impact not only lives, but you impact our community in ways that are really unimaginable. So thank you all so much for everything you're doing. Thank you for allowing me to be here. And we'll kind of jump into your benefits here for the 2022 plan year. So open enrollment will kick off on Monday, November the 22nd, and run through Thursday, December 2nd. So this year we're going to have a passive enrollment. So what does that mean? It's one of two things. One, you do not want to make any changes at all to your current benefits. If that's the case, you want to keep everything the same. You do not have to do anything. We will passively enroll you for what you currently have. The second scenario is going to be you do want to make a change. And if you do want to make a change, you have the ability to do so during those open enrollment dates. And you'll go through and you'll make those changes either on your own or you can set up a meeting with HR. You'll make those changes in Employee Navigator. If you were hired on or after October 2021, you must meet with a member of your HR team to enroll. And so there's the link for an appointment. I'm sure your HR team will get that out to you all so you all can make appointments and reserve your time slots to meet one-on-one. As I mentioned, Employee Navigator, most of you are familiar with it at this point, but we will be using that as a self-service again to enroll in your benefits. I would highly suggest or highly encourage you all to go through and try to recall your username or password from last year. I get it. You probably haven't used it since last year, so the odds of you remembering your username and or password is probably very slim if you're like me. But if you can recall your username, you can reset your password there on your own. If you do need help, know that the HR team and myself will be available to help you through that process. But if you can go ahead and get that squared away, it's going to save you a little bit of time at open enrollment. And so who is eligible? So nothing has changed here. Nothing has changed here. So if you're a full-time employee working 30 hours or more, you're eligible. If you're a part-time employee who works 20 hours or more, you're eligible as well, but the medical insurance will be offered to you at a higher cost. PRN or less than part-time will not be eligible for the benefit program. Dependent children are going to be eligible for the medical insurance, but spouses are not currently eligible for the medical insurance. So spouses are not eligible for medical insurance, but they are eligible for all of the benefits offered. These are your benefits at a glance. Nothing has changed here. There's a few minor tweaks that we'll see, but at a glance, nothing has really changed. You'll notice your retirement plan on the bottom right is no longer Mass Mutual. They were bought out by Empower Retirement. And so you'll see the name Empower. Nothing has changed from your retirement standpoint, though, your 403B. One thing you'll notice is that HealthySU is no longer an option. Telemedicine-wise, we do have an option with Anthem if you're on the medical plan. So we'll discuss that in just a moment. Anthem's still your medical carrier. Your plan design has not changed. You still have a $2,000 individual, $4,000 family plan. You'll see that preventative care is always covered at 100%. Your copays are there to the left, and you'll see that telemedicine is going to be a $20 copay. To the right, you'll see your prescription drugs. You do have a $100 deductible on that, which does exclude generic. So if you have generic, it'll just be a $10 copay. If you are using formulary or non-formulary brand prescriptions, you will have to meet that $100 deductible before the $30 and $50 copay kick in. You'll see your monthly cost and cost per pay are there to the right. Your leadership team has worked diligently to keep that as competitive and as close to last year's cost as possible, and I believe you will not notice any change in that. Wellness credits, they're still available. I would highly suggest that you will take advantage of this. This is basically getting your biometrics done and getting them to your primary care, and what that's going to do is help reduce some premium costs to you. So it's going to save you money and it's going to help you along your health journey. So definitely take advantage of your wellness credits that are available. Telemedicine. So like I just mentioned, HealthySU is no longer available. We're going to do that through Anthem and through the Sydney app. So go on your phone right now, go to the App Store or Google Play and download the Sydney Health app that is available to you. This will get you the opportunity to get in touch with a doctor 24/7 with no appointment or long wait times that is available to you anytime. And they'll help diagnose you with any of your common colds. And so again, the Sydney Health app there in the App Store and Google Play, Healthiest You is a very good provider. However, your utilization rate for them year over year was very low. And so this gives you the opportunity to pay as you use as opposed to a premium up front, and could potentially save you a little bit of money in your pocket as well. So Wendell Foster has worked with Anthem to offer you a $20 copay to use the telemedicine. It's a very good benefit. It'll help keep you out of some of those urgent cares, help keep you even potentially out of the emergency room when necessary. So the Sydney app there at the App Store or Google Play, definitely go download that. Dental has not changed. You're still at Paramount Dental. You'll see that preventive services are always covered at 100%, basics are at 80%, and then your major services are going to be covered at 50%. Your monthly costs have remained the same, and you'll see those over to the right as well. Vision has not changed. You're going to remain with Davis Vision. You can do your examination once a year for a $10 copay. You can get your lenses or contact lenses every 12 months, and then you'll get your frames once every 24 months, and you'll see the benefit payment there in the middle. Again, the costs are there to the right, and nothing has changed for you all year over year on that piece. Group life insurance. So Wendell Foster is very generous, and they're going to pay for you to have a life insurance policy one time your annual salary. They pay for it. It's no cost to you. They're also going to give you a $5,000 life insurance policy for a spouse and $2,500 per child in your house. So that is paid for, free benefit for you through Wendell Foster. And so 2 things to note: the accelerated life benefit. If you're diagnosed with a terminal illness and have less than 12 months to live, you can receive up to 80% of your life insurance through this group policy and or your voluntary life policy, and do with it what you choose. We will want to capture your beneficiary information, and so I will touch on that here at the very end. Voluntary life will be paid for by you. It is a voluntary benefit that is totally up to you. You can select up to $500,000 in coverage, and that's done in $10,000 increments. Now, you cannot exceed 5 times your salary in what you select for your voluntary life. If you select anything over $130,000, they will ask for evidence of insurability, which is basically a health risk questionnaire to determine if you are eligible for anything over $130,000 in coverage. Spouses can get coverage from anywhere from $5,000 to $250,000, and that's in $5,000 increments, but the election cannot exceed 50% of what you select for yourself as the employee. So if you select $100,000 for yourself, the most you could get for your spouse would be $50,000. Do note that evidence of insurability is required if the election is over $25,000 for a spouse. So again, that health questionnaire. Children, $10,000 coverage amount that is available for you as well. Supplemental benefits through Colonial Life. Nothing's changed here. These benefits are only available through open enrollment, and so these are the only time that they are available. And so there's 3 policies that are available to you. An accident policy, which would be you break your arm, they're going to give you a lump sum payment for that broken arm. So quote unquote accident, anything that happens, they'll pay you a lump sum. Critical illness is very similar. They're going to give you a lump sum for any critical illness that you were diagnosed with. So it is based upon the severity of the illness, and then do note that only certain illnesses are covered. The last piece is the short-term disability. And so we've seen this time and time again with COVID. You're unable to come to work because you're sick, yet bills are still rolling in. Short-term disability will pay you a portion of what you make on a weekly basis to help offset some of those bills and expenses that you have on a weekly and or monthly basis. 2 options are going to be available in that is either a 3-month coverage or a 12-month coverage. I would encourage you all to see your benefit booklet for further details on all 3 of these benefits to determine if they are a good benefit for you or if they are not a good benefit for you. EAP, so Employee Assistance Program, is offered to you through the Owensboro Health Park, and it is paid for by Wendell Foster. So this is a free benefit to you. And so obviously we're in very trying times here. Everyone has a hardship that they're going through in some way, shape, or form, or knows someone that is going through it. And so what is available to you is a free and confidential resource where you can have 6 face-to-face meetings with a counselor there at the Owensboro Health Park. And so everyone is going through something, right? I mean, we see it time and time again, financial issues or substance abuse or things that you're going through, or a family member may be going through. And so do note that anyone under your household is available to them. So resources are available to you. Please take advantage of this if you are struggling or want to speak to somebody and just don't know where to start. This is a fantastic place to start. It's free to you, it's confidential, and it can help get you on the right track. So people want to talk, they want to help, and know that resources are available to you. The only thing you'll notice here on your retirement is the name's change. It is Empower Retirement now instead of Mass Mutual, but your total employer contribution is 5% still. This is a great benefit to take advantage of as an employee of Wendell Foster. So what do you need to bring for open enrollment 2022? Social security numbers and date of birth for all your dependents enrolling in any coverage. You must have the social security and date of birth for your beneficiary as well. And so go ahead and get that information, save it into your notes or take a screenshot, whatever it may be, because if you do not bring those, some coverages may not be available to you without having that information. So go ahead and get that information saved so that way you're ready to go for open enrollment. And so that's really all that I had. I really, really appreciate, again, the opportunity to be here with you. Thank you so much. We hope that you all have a great day, and we look forward to seeing all of you all very soon. So thank you all very much.